Good afternoon, everyone. Thank you for joining us on this Facebook Live Q&A. My name is Courtney Wheeler, and I am the Student Government President here at the University of Kentucky. I'm joined today by two people who have been working tirelessly this semester to ensure the health and safety of our community. Dr. Robert DePaula serves as the Dean of the College of Medicine and also oversees UK's START team, a team of public health and infectious disease experts who have approved guidance and recommendations on health measures for the campus this fall. He will provide a recap of this semester and give insight into how we can stay healthy throughout the colder months. Mary Vasevich is our Vice President for Facilities Management and Chief Facilities Officer who oversees the safety of our classrooms, residence halls, and other buildings on campus. Her teams have been instrumental in ensuring the physical safety of our students and employees. Thanks to those who have already sent in questions via email. If you're watching now, you can send any questions to coronavirus@uky.edu, and we will get them as time permits. Let's go ahead and jump in. The first question is for you, Dean DePaula. In your opinion, how successful was the university implementing its screening, testing, and tracing measures this past semester?
Well, I think a very important question, and I think that we've got to always look at kind of measures of success in that we never need to be totally satisfied. We need to continue to monitor and follow, but I think in regard to making sure that students have the opportunity for a residential experience in that regard, we've been able to do that, and I think we've been able to do that with many measures to help assure as best possible their safety as well as the safety of the staff and faculty here as well.
Thank you so much. Mary, this question is for you. UK has invested $2.7 billion to build 6 million square feet of state-of-the-art space. How has this campus transformation impacted the university's overall ability to be successful in delivering an academic and social experience this semester?
Well, I think it's been very positive, actually. When you think about the amount of square footage that's been added to the campus, especially the Student Center, which is a 300,000 plus square foot facility. But these new facilities have improved building systems in them, state-of-the-art systems, so that allows for good air quality in the buildings. We have spaces that we've created that in many of the buildings on campus that allow for areas where students can collaborate while still social distancing. And so I think it's a combination of things, actually. So not only do we have those kind of spaces, but even here in the Student Center, it became a classroom building, didn't it, this year? So many of the ballrooms got used as classrooms. So that's been very helpful for us also for our larger capacity classrooms that we have here on campus.
Yes, I actually am lucky to have a class in the ballroom, so it's been crazy to see how it went from a space where a lot of events would be hosted or we'd bring people to campus to now desk after desk after desk sitting 6 feet apart. It's pretty amazing how many desks can actually fit in there. Dean DePaula, we'll go back to you. Can you remind our community what the START team is, and can you tell us how this team will continue to serve the community in the spring?
Absolutely. Early in the process of planning, for the playbook that that everybody has been using at all levels of leadership to make sure that we've provided a safe campus and a public health infrastructure, we were charged as a team back in April to really come up with guidelines in terms of the initial launch of how we would proceed with testing and tracing and isolation and quarantine and so forth, and then also using the evidence that's out there in terms of what to use in terms of masks versus shields, in terms of social distancing, how to reorganize and think about classrooms and residential facilities, and so forth. And so the START team really was formed as a group of experts, as you mentioned earlier, that included everyone from those on the very basic science of virology to public health, to medicine, to healthcare, to IT, and so forth. We have met regularly, many weeks on a daily basis, to not only help with the initial plans, but then to opine on various kind of points of decision, whether or not we implemented additional testing, or not. So the initial testing that was recommended and then implemented was mandatory testing and what's now being called entry testing of all students. And in retrospect, it seems like it was really a good decision in regard to the fact that we were able to create a baseline and then identify any students that were positive right out of the right out of the gate in the beginning, and then make sure they were safe and taken care of, but then also decrease the chance that they would transmit to to anyone else. The START team continued to meet and still meets. We've met this week as well, looking at other options, thinking ahead, but really evidence-based. So we've been paying attention to the scientific evidence, the new things that are coming out, whether there be new options of potential vaccines and so forth. Already we're discussing on how you might incorporate a vaccine into the strategy of a safe campus as well in the next semester, as an example.
That's awesome. And on that note, what were some of the START's team's biggest challenges this past semester?
I mean, I think probably the biggest challenges were, going back and forth and paying attention to the data and being as nimble as possible to give recommendations that the EOC and the leadership could use in terms of making decisions and then implementing or operationalizing some of those recommendations. We've had to pivot a number of times along the way. When we saw that we were having some facilities that had increasing rates of COVID positive students, we looked at the evidence and found that wastewater testing, for example, might help us target which residential facilities to actually go in and test, and then we implemented that. So it just really required a very nimble approach to pivot as appropriate to be sure that we were monitoring things and then reacting in the proper way. And if you actually look at the curve of or the numbers of active positive individuals throughout the semester, it started coming up a little bit. Never exceeded any of our capacities to deal with it in terms of isolation and quarantine, and then came down at a reasonably stable rate through that period of time throughout the semester.
Yes, it's definitely interesting to watch the curve on the dashboard to see that we always had the capacity, and I think that's not only for the safety of the community here at UK, but also the Lexington community, to ensure that we have enough places for students to be able to isolate and quarantine, and now as we get into the community, it is making sure our hospital capacity has enough. So I definitely think those are really important factors. So thank you so much. Mary, in what ways have operations in campus facilities shifted this semester for the health and safety of our community? Can you speak to the specific changes within the building, such as air filtration and ventilation systems?
Sure. So when, this has been kind of a very dynamic effort going on from the virus lasts 4 hours on a surface to, we were thinking 5 days that it would survive on a surface. So for us, we were following CDC guidelines and ASHRAE guidelines. ASHRAE is the American Society for Heating, Refrigeration, Air Conditioning, and Engineering. So we follow those guidelines very closely, and through that, that directed us to the type of filters we should use in our buildings, and also the number of air exchanges that we want to do in a building, and for us to be able to discharge air as much as we can in any given hour. So we constantly keep the air moving in those facilities. And certainly in our newer buildings, that's easier to do than in some of our more vintage buildings, but we've been very successful throughout the campus in doing that. In addition to that, though, we've really stepped up how we're sanitizing the buildings also. So, all the maintenance folks are my heroes, I have to tell you. The custodians, though, have really been knocking it out of the park. And they have really kind of pivoted in where their focus is, although they're always cleaning in a very direct manner, but really watching for things like door handles and any touches, anywhere, any place, anywhere people would be touching. We've put hand sanitizer stations in buildings. We have done 30,000 signs on campus. In buildings and out on campus, we moved 10,000 pieces of furniture off campus, so we have the distancing that we were talking about in some of the classrooms. We've created plexiglass shields for reception areas, you even see it here in the student center. And in classrooms, we've created actually rolling shields for our faculty to use. In the classrooms, there are hand sanitizer, there are wipes. So I think we've been very conscientious and very directive and specific about what we can do to keep our spaces safe. And I think we've been successful in doing that. I'm very comfortable with the condition of our buildings right now.
Yes, and I know when I go into the Gatton College of Business, all of the desks are labeled, sit, don't sit. There's stickers where you can sit. There's hand sanitizer and wipes. And I've even found myself wiping down my space just for, honestly, the sake of feeling sanitized. And of course, it's always clean, but it's always, it's just being able to have access to those things. And, oh, if a student forgets them, they're there. Masks are there sitting by the doors for students as well when they're forgetting them. So I definitely feel there's access to any sanitation wipes that I might need or hand sanitizer. And can we expect the community to have the same changes in the campus facilities for the spring 2020 as well?
I think most definitely we can. And we need to be cognizant of the change in the weather also. So how we're going to manage our buildings may be impacted a little bit by weather. So we bring a lot of fresh air into the buildings all the time. So how much are we going to be able to do that? We think because we've had obviously students in classrooms now and the buildings have been functioning well, that we won't have any problem during the colder weather months also. So we're pretty comfortable in that regard.
I think that's interesting to think about fresh air. I think about all the times in the student center where the doors are standing open for minutes upon minutes, or definitely going to make the entry level where all the students are walking colder in the winter months. But I think that brings a unique perspective of how much fresh air is coming to a building. I didn't even think about that. So thanks so much for sharing that. Dean DePaula, currently the university is pushing for two big things for students: COVID-19 exit testing and flu shots. As a medical expert yourself, can you explain to us why both of these are so important?
Yeah, no, absolutely. When you think about, to take the exit testing first, we know that many of the students here, because of the fact that they may be asymptomatic and positive for COVID, that by testing at an increased rate, we should be able to do a better job in terms of identifying anybody that might be positive and in fact asymptomatic. Obviously, if they were symptomatic, because we're screening on a daily basis, we should be able to pick that up as well. What we would say is that if now some of those students are going back to their residences or families where they may have family members that are at higher risk of being symptomatic and affected by COVID in a much more serious way, we want to make sure to provide an opportunity to identify that and comfort both the student and the families before they go back to their families. And so I think it's very important that we offer that as an opportunity, and obviously that's what was implemented. In terms of the flu vaccine, and I know there was a lot of discussion, and we had a lot of discussion, do you make it mandatory or not? But we've got to realize we are in, oops, something happened. I think just something fell. We got to realize that we are in a very unprecedented situation and an unprecedented time. And when we know that flu itself, as an entity, can also be asymptomatic, can pass on to individuals. Many individuals, especially those with other illnesses and so forth, could have significant effects from the flu. So they could get very sick from the flu, and there is, an associated mortality rate as well. And what we're concerned about is that if we introduce the possibility of flu and then COVID, we could have individuals that have both, putting them at greater risk in terms of being ill or worse. The other thing is that the flu symptoms are very similar to COVID-19 symptoms. And what that would do is it could overwhelm capacity if we had more individuals that had flu symptoms, where at the moment we have somebody who's symptomatic, we go down that path of needing to test and sort that through as well, and possibly, again, isolate or quarantine. So I think it's for the health of the students, it's for the health of their families, and we've been asked questions about, well, the semester's almost over, why get the flu vaccine? But we've got to keep in mind that we still have flu season going into the next semester.
I think that's a really great advice, and I know that especially when we're talking about going home to loved ones or whether or not a family is celebrating Thanksgiving or any of the holidays, it's so important to ensure that you're not the one bringing it into your family. And sure, our numbers on campus might look a little different than the community, but it's so important to just be sure. And I know that I've even had students ask me, are they testing, so that because students are wanting that. I think some parents or family members or loved ones are asking them and requesting them, because we've honestly lived two different lives. We've lived our family and have our friends here on campus, and now we're going to merge it with our family at home or our support system at home. I know for me and a lot of my friends, we didn't go home throughout the semester because we wanted to ensure that separation and that we're not cross-contaminating. So I think that's a great option, and it will be available just as what we've already had at the 90. And I've even heard they're going to ramp up the amount of people there so that students will have those options. So just again, for students, make sure you're getting that exit testing so that you can keep your loved ones and your support system at home safe, and also get your flu shots. Because flu, unfortunately, won't be gone in January 25th,
Correct.
Just like probably COVID won't be gone either, so it's just important to be prepared. So thank you so much. Mary, now that it's starting to get cold, will facilities play a larger role in mitigating the spread of the virus since more people will be inside?
Well, I think to some degree, yes, and our custodians will be actively engaged as they have been. This semester we provided cleaning kits for offices, so individual offices, the occupant can clean their offices for us, while the custodians can focus on the areas where are more public and where folks are congregating, be it social spaces, be it classrooms. So we will really drill down on those areas. And of course, it's not just 8 hours a day. I mean, we've got folks that work around the clock in facilities. So in addition to that, we've got to closely monitor our building systems, and we do that regularly. We've got a whole team of folks here that watch temperatures in buildings, airflow in buildings, and so we'll continue to do that and address any issues that come up along the way. But we will continue to follow those guidelines that we see from ASHRAE and CDC, and they might come up with something else. And when they do, we'll be ready for it.
Yes, that's awesome to hear. And I know that the custodians here in the Student Center are the nicest people. They're always willing to, if you need something, they're willing to get it for you. If you're in need of just an extra garbage bag, or hey, the carpet in my office is really dirty, do you mind to clean it? They're always willing, and they're just happy and smiling, and I think that's so important while they're cleaning the doors. Always, I feel like they're always touching the doors when I'm walking in and out of the Student Center. I feel I'm always in their way, but I know that they're really keeping us safe here, and so it's great to see that they've really stepped up and want to keep people safe. So Dean DePaula, as we transition into the winter months and reconvene in the spring, what are additional tips you can give our members of the community to stay safe and healthy?
No, it's an important question, and I think that it really comes back to what we've learned about COVID-19 over this period of time, and we've certainly learned that we have to be concerned, as you mentioned, on surfaces. But the biggest concern is aerosolization. So basically, being exposed because somebody has because they were talking or coughing or whatever, that they've aerosolized the virus, and the other person either catches it because they breathe it in, or it could even be caught in their eyes and so forth. And so masking is incredibly critical and critically important. And the other aspect about masking is we've got to think about social gatherings. If a lot of people are gathering that typically weren't together, I mean, obviously if your family's together on a regular basis, you understand that, and they are together usually on a regular basis, and you'd know that for the most part they're doing okay. When you start to gather with additional individuals, it's always possible there could be somebody who's asymptomatic. And in truth, when you're gathering, especially around food and drinking, and not necessarily alcohol, but just any drinking, people do remove their mask periodically. And so we always need to be very cautious that any time any individual is coming within 6 feet and they're removing a mask, there's always that chance of exposure. So I would say we need to be very cautious about gatherings, very cautious about adhering to mask wearing as best possible, and very cautious about social distancing. One thing to also think about is that even amongst people that you know, friends and family, every little bit probably counts, meaning, it doesn't have to be all or none. You can think and say, well, I'm going to eat here, but let me keep the mask off as minimally as possible. So just do it at a shorter amount of time, or back and put it back on. So that matters. Or if I'm going to remove my mask and I'm eating, keep it a social distance, 6 feet or more, so that you're at least adhering to another layer of protection. So it's like all layers of protection: the mask, the social distancing, numbers in a room, and so forth. And then the other piece is being outside versus inside. And as Mary pointed out, we're going to be in a situation when it gets a little bit colder, it's tougher to do things outside. So we got to realize that we might not have an event or a gathering of some sort. In fact, we should really not be gathering. But if a group of people are together, it's obviously better outside than inside because of the dilution from the air. So think about the layers of protection: masking, social distancing, reducing or not having gatherings, and being cautious with all of those components as best possible, even if it's only one part of it, for instance. So if you're going to eat and your mask comes off, just do it for a short amount of time and then put it back on.
Yeah, definitely mask wearing is super important. And I think even for our students, we always were telling our students with student government, be the trend center, wear the mask, wear the mask, wear the mask. And I think it's imperative as we get closer and closer together, because we're not outside and we're not having as much fresh air because it's just cold. Earlier this week when it was beautiful outside, I was like, man, this is so great.
Get out,
But now it's getting colder, we're getting more inside, so it's important to really be that trend center, wear the mask, because it is a layer of protection. And so this last question I'm going to ask for both of you, but we'll start with Mary. Finally, this semester has been difficult for all of us, students, faculty, and staff. But when we're thinking about supporting students and employees' well-being and academic success, what have you seen this semester from our community that makes you proud or gives you hope?
Well, I always talk about the folks in facilities management, that they love working at the university here, and they're loyal to the university. They're kind of passionate about what they do, and they want to do good. So that's a great formula, isn't it, for success? But they also believe that they play a role in graduating students here. I always say to them, think anybody wants to be here if you're not doing your job, right? It would be virtually impossible. So I think there's been a sense of camaraderie also, and I think when I walked around campus the first couple of weeks of the fall semester, I was really surprised at how many students were already masking up, and really committed. And so I think it's been our faculty and our staff and our students that have all come together to get us to where we are so far. So it kind of shows you that we can do anything. And so that's what I'm proud of. And we're going to get there.
We are. We're just a few short days away.
That's right. That's right.
Dean DePaula, is there anything else that you would like to add?
No, I mean, I just want to say, and I agree. I mean, what's been really amazing this whole semester is how everybody has come together. I mean, I think that everybody's been, just, passionate about, really caring about the campus and having this residential experience here. The students are working together. I mean, I hear around the country that that's not always the case. Mm-hmm. Everybody's really working hard to be sure that we could have and continue to have a residential campus. Communications have been incredible. I mean, the president sending messages out on a regular basis in terms of every change or every opportunity that we could have to be safe, and the students as well. Even the fact that it was kind of framed as a testing week or two or whatever coming in as entry testing. I mean, we all know what a testing week is or mm-hmm. whatever. So I just think that people have really come together. And obviously I also see it on the health system end as well. Just, all of the faculty and staff, and students as well, just really caring for those patients in need, making sure that we had capacity to handle the things that we needed to handle for, and to really carry out the mission of for us, clinical care, obviously education and obviously research as well. So it's been really an amazing demonstration of coming together, here as one UK.
Yeah, I think one of the things that gives me definitely hope is the fact that students here are willing to check up on their friends that are quarantining and isolating, or just give them a call even if they aren't. Mm-hmm. I've seen our Wildcat community come together, whether it's virtual, whether it's 6 feet apart, whether it's figuratively, in a way that I never could have ever hoped or dreamed of more than what I'm seeing. I mean, our students are taking care of one another, offering to bring groceries or bring food or just distract them from the outside factors that can be really stressful, really anxiety-ridden. And we're so close. That's what I keep saying.
We are.
We're 2 weeks away from Thanksgiving, and we're less than that until students get to go home, until we get a few-day break before we have to take our finals. But we're almost there, and we definitely look forward to making it to Thanksgiving and coming back to the spring semester. So thank you so much for joining us today.
Thank you.